Good day. I'm Professor Matthijs Labuschagne, and I'm an ophthalmologist, but I'm also head of the Clinical Simulation and Skills Unit. Today I'm going to show you a dissection of two eyes. So they already removed the eyes from the cadaver, so I'm going to focus on the different structures of the eye. Okay, so this is the right eye. Removed from the cadaver. So you can see this is a whole block. So I'm just going to show you the different structures. So if you look here, then you can see this is the medial canthus. So that is the medial part of the eye, where the eyelid, and this is the lateral canthus. Then you've got the superior eyelid and the inferior eyelid. The white part is the sclera, and this clear part here is the cornea. Where the cornea and the sclera meet, we call it the limbus. The sclera is covered by conjunctiva. So the conjunctiva is a mucous membrane covering the sclera, and it starts at the limbus, covering the sclera, that we call the bulbar conjunctiva. Then it bends on itself, and then it covers the inside of the eyelid, and that is the palpebral conjunctiva, and it stops at the gray line on the eyelid. So you must go and have a look at the anatomy of the eyelid and the different glands that are situated in the eyelids. Today I'm going to focus on the eye dissection itself, so I'm not going to spend a lot of time on the eyelid. So I'm just going to turn this around so that you can see. So if you look here, then you can see this is the superior eyelid. So this is the nerve going to this, so that this is the frontal nerve going to the upper eyelid and the frontal part of the. So this is a block of tissue. So what I'm going to do is I'm going to remove that so that we can see the different structures. So if you remember, this is the medial side, and this is the lateral side. So if we look, where is the lacrimal gland? So if you look here, then you can see this part here, that is where the lacrimal gland is situated. So I'm just going to do a dissection, remove some of the tissue so that I can show you the lacrimal gland. So if you look here, then you can see this tissue that you see here, that is the lacrimal gland. So there is the lacrimal gland there. And one of the branches of ocular motor is the lacrimal nerve, and there is the lacrimal nerve going to the lacrimal gland. The lacrimal gland is situated supratemporally, so that with the production of tears, it runs over the eye, and it drains through the canaliculi on the medial side. So let me just clean this so that we can see the different structures. Okay, I've completed the dissection of the posterior part of the eye. So just to orientate you again, so this is the superior part, this is the medial side, and this is the lateral side. So if you look here, then you can see this is the posterior part of the eyeball. So that is the posterior sclera. That structure that you see there, that is the optic nerve, and the optic nerve is covered by the meninges. So the dura, the pia, and the arachnoid mater, the same as the brain. And then if you look here, then you can see there's some structures just next to the nerve. Those are the branches of the oculomotor nerve supplying the different muscles. And there is, if you look closely, then you can see there's small structures entering the eye there, and that is the posterior ciliary nerves and blood vessels. So if you look here, then you can see this is the superior rectus muscle. This is the inferior rectus muscle. This is the lateral rectus muscle. So the lateral rectus muscle is supplied by the sixth cranial nerve, the abducens, while all the others are supplied by oculomotor. This is the medial rectus. And then if you look here, this structure that you see here, that is the superior oblique muscle. And if you look here, the structure that we see here is the inferior oblique muscle. So the superior oblique is supplied by trochlearis. So please go and have a look at the nerve supply for the different extraocular muscles, and go and have a look at the actions of the muscles. In the clinical setup, we will talk about the actions again, and then we will discuss it in more detail. I just want to show you, so what I'm going to do is I'm just going to cut the optic nerve so that we can see the different structures. So if you look here, then you can see, if you look closely, then you can see there are the meninges covering the optic nerve, and the optic nerve is there. And in the center of the optic nerve, the retinal artery is running, and then it goes into the eye through the optic disc. Okay, here you can see I've removed all the structures. So what we have left here is the eyeball with the optic nerve. So what I'm going to do now is I'm going to do a cut, a sagittal cut through the eye, so that you can see the picture that is usually drawn in the books. So I just want to cut through the eyeball. Then I'll show you all the different structures. Okay, so what I'm going to do is I'm going to show you the different structures. Let me just open the other side as well. So a very important thing to remember about the eye, that it is a three-dimensional structure. So you must always think as a three-dimensional structure and not two-dimensional. So what I'm going to do is I'm just going to remove this part so that I can show you the different structures. Okay. So if you look here, then you can see that is the cornea, the clear part is the cornea, and as I said, the conjunctiva stops at the limbus. It does not cover the cornea. In a lot of the books, it seems, and in the pictures, it seems as if the conjunctiva covers the cornea, but it does not. It stops at the limbus. So just between the cornea and the iris is the colored part of the eye. So that part there is the anterior chamber. Then the iris, and in the iris is the pupil. So the pupil is actually just a hole in the iris. So remember now, I just want to show you here again. So if you look here, it is three-dimensional. So there is the anterior chamber. That black part there is the iris. And just behind that, so if you can look there, can you see those lines that you see there? That is the ciliary body. So the ciliary body has got suspensory ligaments or zonules keeping the lens in position. So the lens is this white structure that you see here, and that helps to focus the rays onto the retina. So the anterior chamber is between the cornea and the iris and the lens, and the posterior chamber is between the zonules there and the iris. So it's very small. And this part here is the vitreous cavity. So that is not the posterior chamber. So anterior chamber, posterior chamber is very small, behind the iris and between the iris and the zonules and the lens, and then posterior to that is the vitreous cavity. You see this jelly-like substance? That is the vitreous. So that covers the retina. So what I'm going to do is I'm just going to clean it so that I can show you the different parts here. So if you look here, then you can see that I'm pulling now on the vitreous. I'm trying to remove it. It's quite sticky. So in the clinical, we will teach you all the different diseases affecting the eye and the vitreous and the retina. So I just want to clean that part so that you can see it better. Okay. So what I'm going to do is I'm just going to show you, so what you see there, those lines there, that is the ciliary body. So in the ciliary body, the suspensory ligaments suspend the lens, but it also produces the aqueous. So the aqueous drains from the ciliary body into the posterior chamber, through the pupil into the anterior chamber, and then it drains through the trabecular meshwork, and the trabecular meshwork is situated here in the angle here, and from the trabecular meshwork to Schlem's canal, and from Schlem's canal into the venous system. So if you look here, then you can see there is a brownish part, and then you've got the whiter part. So the whiter part is the retina, and that grey part is the pars plana. So why do I tell you about the pars plana? The pars plana is the area when we do operations, we go through that area. So we put our instruments in there, and then we do the operation in the posterior chamber. If you go through here, then you will make a hole in the retina. So the important thing is this area here, this small little area between the ciliary body and the ora serrata, or the anterior termination of the retina, is called the pars plana. And the operation we will do is a pars plana vitrectomy. So if you look here, this whitish area that you see here is the retina. So what I'm going to do is I'm going to cause a retinal detachment. So I'm going to remove the retina so that you can see the choroid. So if you remove the retina, so the white part there, then you can see this brown part there. So there I'm removing the retina. So that white part is the retina, and then this brown part is the choroid. The choroid is a vascular pigmented layer just behind the retina. And then if you remove the choroid, then you are on the sclera. So there you can see. So the white there is the sclera, the brown there is the choroid, and the retina is the whitish area, and then you have the vitreous in the vitreous cavity covering the retina. So if you look, so in semester 6 I will teach you how to do fundoscopy. So fundoscopy is where you use an instrument to look at the posterior part of the retina. So then we will look at the optic disc. So I just want to show you the optic disc. The optic disc is quite small. I just want to clean it. So if you look here, can you see that area there? So you see I'm holding the eye on the optic nerve, and that area that you see there, that is the optic disc. So all all the retinal nerve fibers, the retinal nerve fiber layer, runs to the optic nerve, so they go there and then they go through the optic disc and they form the optic nerve. Something I haven't talked about is the lens. So there you can see this white structure is the lens. So if a patient, the lens helps with the refraction. So it helps to focus the light rays onto the retina. So if you have a cataract, what happens is the lens becomes opaque. So then the patient cannot see through it anymore, and then we have to do a cataract extraction. So what we do is we make a small little opening here in the cornea, go in, dilate the pupil, remove the anterior cortex of the lens, remove the lens and put in an artificial lens. But we will teach you this in the clinical rotations as well. So what I'm going to do now is I'm going to remove the lens to dissect the lens. So I just want to show you the different structures so you can see the zonules keep it into position. So I'm just removing it. So there you can see the lens is a round biconvex structure, and that's why you've got an inverted image on your retina, because it's biconvex. So the lens has a capsule, so that's the outer part, and then it's got a cortex, and the inner part is the nucleus. So I'm just going to cut through the lens to try and show you the different structures of the lens. So if you look here, then you can see this white part on the outside is the cortex, is the capsule. This yellowish brownish area that you see there is the cortex, and that center part there, that is the nucleus of the lens. So when we do a cataract operation, we will remove the anterior capsule, we will remove the cortex, we will remove the nucleus, but we will leave the posterior capsule. So if I just put it back here, then what will happen now is you will remove everything except the posterior capsule, and then we will put an artificial lens in the place on top of the anterior of the posterior capsule. So this is just a little bit of clinical application to show you. So this is basically the dissection of the eye. So what I suggest is go and read up again on the different structures of the eye, the extraocular muscles, the nerve supply to the extraocular muscles, and the actions of the muscles. Now I just want to recap the anatomy of the orbit, the bony orbit, and the openings and the structures going through that. So if we look at the orbit, then you can see that the orbit has got a floor, it's got a medial wall, a roof, and the lateral wall. And you can see it's cone-shaped, and then it ends there at the apex in the optic, the opening for the optic nerve. And then there, that area that you see there, that is the superior orbital fissure. That is the inferior orbital fissure. This is the opening going to the nose for the nasolacrimal duct. So if you cry, then the tears are draining through this opening through the nasolacrimal duct into the nose, and that's why your nose is running. I've put in a piece of suturing material just to show you where the optic foramen, so there you can see that's the optic foramen, And if you look here, then you can see where it comes out. So your hypophysis is situated here. So the optic chiasma is here. So it crosses over here, and then you've got the visual pathways running in the brain, and then at the end in the occipital cortex, where your visual area is here in the occipital cortex. So it's just good to see where the opening is, where it enters the orbit, and where your optic nerve. So we've seen the optic nerve. So the eyeball is situated here with the optic nerve running through the optic foramen. And then if you look at the superior orbital fissure, let me just get this, then I'll show you. So if you look here, you can see there's the opening for the superior orbital fissure. And go and have a look at the different structures going through that. Here at the apex is the annulus of Zinn. So that is a circular structure. And then some of the nerves and structures run inside the annulus of Zinn, and some of them run outside the annulus of Zinn. So you must go and revise that as well. So the rectus muscles are attached to the annulus of Zinn here at the back. So if you think the back at the dissection, then you can see that the four muscles run, and it's rectus muscles because they are straight. So they run from the annulus of Zinn here at the back to the anterior part, and they attach anterior to the equator of the eyeball. Your superior oblique runs also from the annulus of Zinn, and then your trochlea is here, so it comes there and then it turns back on itself, back onto the eye, and your inferior oblique attaches here onto the orbital rim, and it goes and it attaches posterior to the equator onto the eyeball. If we look at the sinuses, then you can see this is a frontal sinus that you can see here, so it is situated here. Then you've got your maxillary sinus that is situated here, and then you've got your ethmoid sinuses in this position here. So if you look here, if you look carefully, if you look here on the skull, this is the lamina papyracea. So that is a very, very, very thin piece of bone, and between the orbit and the ethmoid sinuses. And then if you have a sinusitis, what can happen is you can get an infection, and it can break through that thin bone, and then you can develop orbital cellulitis, and then you will have a problem with proptosis, where the eyeball bulges out. And posterior to the ethmoid sinuses, here more to this area here, is the situation of the sphenoid sinuses. So this is just a short recap of the anatomy of the orbit and the structures around the orbit.